Hello everyone, we're the team behind Hepatitis A. I'm Fayra Dawi.
I'm Kamil Samara.
I'm Moza Zahabi.
And we've prepared a presentation to tell you more about our work and outline the main important points in our research. This is the presentation outline. I'll start off with the background. Why this topic? So, we have three main reasons of why we chose Hepatitis A. First is the personal aspect. I personally had two friends who got Hepatitis A. Both of them were misdiagnosed, and one of them passed away sadly. This was my first introduction into Hepatitis A, and it got the entire team interested. Second is the medical aspect. We didn't know anything about Hepatitis A, and what are the consequences, and why is it dangerous. So delving deeper into it got us even more excited. Lastly, we knew such kind of viruses are of a major public health concern that WHO always raises awareness about. So we knew our presentation about Hepatitis A and our results would bear fruit into public health of the UAE. So I'm gonna summarize the most important points about Hepatitis A. The virus is transmitted fecal-orally or through close contact. And the presentation is usually asymptomatic in childhood, and it gets more serious as the person gets older. There are around 1.5 million annual cases of clinical Hepatitis A, and the most feared complication is liver failure, which is irreversible and might indicate a liver transplant. In the UAE, the infection was rare in the past, but due to better sanitation and food cleanliness, children are getting less exposed to the virus, leaving them more susceptible into adulthood. Lastly, and luckily, there is a vaccine against Hepatitis A, which is in the immunization schedule of neighboring countries such as Saudi Arabia and Bahrain, but not in the UAE. Moving on to aims. In our study, we narrowed down our topic into the most important points regarding Hepatitis A and public health. We focused on the knowledge, attitudes, practices surrounding Hepatitis A, and the vaccine and its applicability. Now that's a lot of ground to cover, so I'll hand over to Musa.
Thank you very much, Faye. I'm going to be continue talking about the methods. Okay, so first off, for the design of our study, it was a cross-sectional descriptive quantitative study, meaning that for the first few weeks we were gathering data to measure everything we needed to know at a specific point in time. We also used convenience sampling, meaning that we approached people in parks, malls, and other public spaces. We actually began data collection back in February of 2020, which is right when the COVID pandemic began to unfold. So it was surreal to think that we were able to go up to 50 people a day and talk to them and even thank them in person. We gathered a total of 550 responses from the 4 largest Emirates, which included Abu Dhabi, Dubai, Sharjah, and Ajman. And now, as for the instrument, we first began reviewing literature on hepatitis A by looking at WHO reports and other scientific papers. We developed a questionnaire, tested it, translated it, and had a pilot study. Additionally, we gave it to a biostatistician to review for validity. And finally, for the analysis techniques, this was the most difficult and time-consuming part. We started off with univariate techniques. This was to get an idea of what our study looked like, and this involved generating graphs and understanding statistical characteristics such as normality and skewness. And we also did bivariate techniques, specifically non-parametric ones such as cross-covariance and logarithmy. Finally, we used multivariate techniques such as simple, linear, ordinal, and logistical regression. And moving on to the results. For the demographics, we can see that both the age and sex were fairly distributed, and most of our participants were not from the medical field, half of them were married, and our nationality profile matched that of the UAE's, which made the Emirates constituting of 11%. The distribution among the Emirates was equal, which was what we initially planned. And as for the knowledge, only the people that stated that they had some knowledge about hepatitis A were the ones that answered this section. The results showed poor knowledge, and if we look at specific questions, it was very obvious that a significant portion of the people were not even able to differentiate between the hepatitis viruses, and this led to a false perceived knowledge. That is it for the knowledge, and Kamil will continue with attitudes.
Thank you, Musa. So now moving on to the attitudes, they were actually very positive. So immediately what you can see is that 99% believe that vaccines are important. Additionally, even adult vaccination was perceived positively, with more than 65% stating that they believe that adults and elderly need to get vaccinated. Now, we believe that the success that the UAE has had with COVID vaccine reaffirm these positive attitudes that we have found. Now moving on to the practices. So with the practices, we asked a lot of questions, but one of the foundational questions was, would you get the hepatitis A vaccine as an adult? And as you can immediately see, the majority, so 40% stated they would need more information to decide. Again, highlighting the importance of knowledge and what it plays in countering such a disease. So after that, we asked them, would you like to learn more about HIV? And in accordance with what we just saw, 85% stated, yes, I would like to learn more. But then what would your main source of knowledge be? We found that more than 50% found a physician to be that source of knowledge. But the second most common one was the internet and social media. Finally, we wanted to know the trustworthiness of such a source. So you're using it for information, do you trust it? And surprisingly, but reassuringly, 85% stated that they'd find a physician to be very or extremely trustworthy. No other source of knowledge came close at all. Now, coming to the bulk of our study, so as Moses stated, the analysis did take a substantial time. Now, what are we showing here? It's a pretty dense table. So first, we look at the possible different determinants. So we had demographics, knowledge level, perception, and knowledge source. And then we wanted to see with which feature did they have a relation. So we looked first at bivariate, and we did the statistics. Now, but then there's the possibility of confounding. So to counter that and to control for that, we did the multivariate analysis. So eventually, we got every determinant and then we tabulated it to see which one is consistently being a positive determinant. We found that females was actually the strongest determinant, being like a determinant of positive attitudes, practices, vaccination knowledge, and vaccination attitude. But what was most surprising is that knowledge kept popping up again and again. So here, when you look, you see that the bachelor's degree, the perception of knowledge, the knowledge source, even the knowledge itself were consistently a better determinant of attitudes, practices, and the awareness in general of the vaccine, of the virus and its vaccine. So we've told you all of this. What's the point of this? What's the significance? What are the actionable points? Well, we have two immediately obvious points. Number one, awareness campaigns. There's a very deep trust in the local immunization program, in the public health system. And we need to cultivate that. We need to promote that. We need to make sure we preserve that. How do we do that? Well, number one, awareness campaigns. We need to tackle any sort of vaccine hesitancy information, any of these anti-vaxxers on social media. Make sure we're tackling anything head on. Second is the vaccine introduction. So the hepatitis A vaccine has long been shown to be highly immunogenic, no safety concerns. It's been shown to provide protection for up to 40 years from its administration. Again, we believe that introducing it into the vaccine will reduce the clinical incidence of hepatitis A and its burden in the UAE. Okay, so to conclude, what's the take-home message? What's the one thing you need to remember? Well, 4 things. First, we found that for hepatitis A, the knowledge and the practices were poor, but the attitudes were positive. Then we found that unanimously, a lot of the participants found that vaccination is important. Unanimously, it was very surprising. Then for the vaccine uptake, we found that if the vaccine were to be introduced into the local immunization schedule, parents would be more willing to vaccinate their children. Again, highlighting this deep level of trust. Finally, for the sources of knowledge, we found that the physician was consistently a more trustworthy source of knowledge for the public. So thank you.
Thank you very much. We hope this was informative.
Let's aim for a hepatitis-free future.
Thank you.
Thank you.